Chapter 15, Health, Population, and the Environment. For Chapter 15, we are going to discuss sociological perspectives on health and illness, social epidemiology and health, healthcare in the United States, what is mental illness, population, migration, sociological perspectives on the environment, environmental issues, social policy in the environment, environmentalism. Health is considered the state of complete physical, mental, and social well-being. So it's not merely the absence of disease and infirmity, and that is from the World Health Organization. So health and illness are socially constructed, so our ideas of what it means to be healthy and our ideas of what it means to have an illness and to live with an illness. From a functionalist perspective, being sick must be controlled because people aren't able to participate in society as they normally would if they were healthy, and that would be interactions with family members or even working. And we have the sick role where society places expectations and attitudes about a person that is sick. So we have ideas of what this person should look like, how they should feel, how they should be able to perform work. And then physicians function as gatekeepers for the sick role. So in order for a person to be labeled as sick in our society, we basically rely on physicians to tell us if they're sick or not as proof. From the conflict perspective, society has become medicalized, and that means that there is a growing role of medicine as far as social control goes. So we basically rely on physicians in order to hopefully cure people from certain ailments, and that would be not just illnesses, but child development, drug addiction, anxiety, age, obesity, alcoholism. There are a variety of roles we expect physicians to take on, hopefully in the hopes of curing people in our society. And it also has greatly expanded its domain to all those other areas besides just taking care of chronic illnesses or trying to cure someone of a short-term illness. And the problems are viewed using a medical model. So everything is something that can be either cured and fixed, or the person is healthy. So it becomes more difficult for common people to join the discussion since common people don't have a medical license. And people are less likely to believe them in their views. And sometimes people have experience with certain diseases or illnesses just from their personal experience or with families, but they might be dismissed because they might not have a degree. Or if someone considers themselves a natural healer or use herbs, some people don't believe in that. And then medicine retains jurisdiction over healthcare. So basically, medicine is the end-all be-all when it comes to healthcare. As far as the U.S. goes, we don't rely on complementary medicine or like alternative medicine, and those would be other natural remedies of how to deal with health issues, or even things like acupuncture. Also, from the conflict perspective, we have obvious inequities in healthcare. So that could be from people of different races, different social classes, people that have insurance versus those that lack insurance, and also people from different countries. We also have a brain drain, and that is where a lot of different professionals migrate to the U.S. And they leave their countries without. So that would be skilled workers, professionals, and technicians. And then we also measure the health of a country by the infant mortality rate, and that is the number of deaths of infants under the age of 1 per every 1,000 live births in any given year. And we're able to measure a country's health status by that because we look at the prenatal nutrition, delivery procedures, screening measures, access to healthcare, insurance rates, diseases, and then how people in the So figure 15-1 basically is the infant mortality rates in certain countries, and poorer nations have higher infant death rates compared to industrialized nations. And also the nations that have access to consistent health care, their infant mortality rates are less than in the US. From the interactionist perspective, they basically look at the role that healthcare professionals and patients play on the micro level. So patients seek out care when they are ill, and in the interactionist perspective, like to look at how physicians interact with patients, how do they determine if a patient is ill, and how do they go about bringing that proper health care for that patient. So patients can be positive for their health or negative to their health, and it's the nature of the provider-patient contact that we have to look at in order to reduce inequities. The labeling perspective attempts to explain why certain people are viewed one way while others who participate in that same behavior are not labeled in the same way. So some people that smoke weed are labeled as bad, while other people are labeled as just somebody who's going through something or someone that is just experimenting. So we're just basically looking at what makes one group labeled okay while doing a behavior, while another group isn't labeled okay while participating in the same behavior. Another example is homosexuality. So some people labeled it as something that is natural, and others label it as something that is from society and what was imposed on them or their experiences. Social epidemiology studies how disease and illness is distributed in a population. So they want to know how many people have heart disease in a certain area, or how many people contracted the Zika virus in a certain area. So they also now track down bioterrorism, and that would be if someone were to spread anthrax or any other substance or illness to a certain population. They look at morbidity rates to see how many people have certain diseases in a population per every 100,000 people, and they also look at the mortality rate to see how many people die in a population per every 100,000 people. As I previously mentioned, social class does have an effect on health. So people in lower social classes have higher rates of mortality and disability, and it affects their lives more. It has a ricochet effect from one issue to the next. Also, poor people are less likely to afford quality medical care, less likely to have insurance, and less likely to be heard by their physicians that they interact with in the ER, since the ER is such a busy place. Also, conflict theorists basically talk about capitalist societies care more about maximizing profits than they do actually care about the health and safety of their workers. So if you think of the pharmaceutical companies and how much they charge for insulin, so conflict theorists are basically saying that the companies care more about their profit margin, how much money they're making, versus actually making sure everyone has access to it. Race and ethnicity has an effect on health because of how people are treated when it comes to the social construction of race. So people of different races, usually minorities, do not receive the same health care as the predominant race as far as whites go in the US. And that is because of insurance rates. It is because of biases, which some people are aware of, and then others are not aware of their preconceived biases. And so there are poor economic and environmental conditions that also reflect and cause a detriment to the health of minorities. So if someone lives in an area with lots of factories, they'll have higher asthma rates, and you see that actually reflected in the health of children in Louisville. So African American kids have higher rates of mortality and diseases compared to white children in Louisville, Kentucky. So African Americans also have higher rates of asthma, lead exposure, especially people that live in the West End. And then Mexican Americans may actually use other forms of holistic healthcare and healing, and so they may use a curanderismo to deal with that. Gender also plays a role when it comes to health. So women tend to live longer, but they have a higher prevalence of illnesses. And sometimes the prevalence of illnesses center around the childbirth experience or the labor experience or actually the experience of getting pregnant. So it's theorized reasons why women live longer. Women smoke less, drink less, have lower rates of employment in jobs that are considered dangerous, and women are more likely to seek care. So as far as a conflict perspective goes, women are more vulnerable to the medicalization of society, and once again, that could deal with childbirth or preconception. And also when people have issues conceiving, so as far as infertility and fertility rates, women experience more. And also, women return to work, usually at a time period when their bodies aren't ready to return to work, since it takes at least a full year to recover from pregnancy and delivery. Age also plays an effect with health. So there are more older people that are retiring, more older people that are aging, that are also living longer. And at least most people in the US have at least one chronic illness, especially the older population. And then most people in the US have at least one mental health issue or one mental break for a period of time in the US. Also, the older population deals with Alzheimer's, and older people use more health services than younger people. Healthcare costs have skyrocketed in the US, and that is due to the price of healthcare. It's due to the aging population. People are living longer, people have more illnesses, technology. So a lot of money is being spent on healthcare, and we are basically going to have to come up with a way in order to decrease the amount that's spent on healthcare, but to keep our population living longer. It says by the year 2020, expenditures are expected to exceed 4.6 trillion, but that number might actually be higher now. Physicians traditionally hold positions of dominance with patients because of their experience, and there's a white coat syndrome, which makes patients nervous when they know that they are going to see a doctor. So from a functionalist perspective, physicians and medical school professors serve as mentors for those medical students. And from an interactionist perspective, students are molded by the medical school environment, and both lead to dehumanizing physician-patient encounters because they aren't spending enough time with patients, they don't fully understand what patients are going through, and there isn't a lot of bedside manner or communication that's taught in medical school. So there's patient overload, cost-cutting, publicity about malpractice lawsuits, and then the high medical costs help strain the relationships. So some patients don't trust the physicians, and some physicians are so overworked that they are less emotional and less sympathetic to their patients. So there are alternatives to the US's traditional healthcare system. So some people rely on prayer. Some people rely on alternative medicine. Some people rely on complementary medicine, and that could be alternative medicine that is used alongside traditional healthcare. So, like I mentioned before, acupuncture could be considered alternative medicine, and they could use that along with receiving medication from a doctor, so that would make it complementary. Then there's holistic medicine, where they look at the whole entirety of a person, so they include physical, mental, emotional, and spiritual characteristics. So this figure basically demonstrates the use of complementary and alternative medicine and the percentages of people that use these. There's yoga, a chiropractor, meditation, massage, diet, prayer, prayer with others, prayer for self, deep breathing techniques, and other natural medicine. The role of government. So in 1946, we had the Hill-Burton Act, and that basically helped give money to those that wanted to build hospitals and improve buildings, and especially in rural areas. Then we have Medicare and Medicaid. Medicare is predominantly for those that are elderly or disabled, and then Medicaid can also be for some that are disabled, but it's more likely for those that are of low socioeconomic status, and for children. Then we also have in 1983, the government instituted a price control system, and that would be where if someone was in a private hospital, they could be dumped into a public institution because the private hospital doesn't want to lose money over the patients that cost too much, that probably can't afford the bill. And then in 2010, we had the Affordable Care Act, and that improved health insurance coverage for all people of all ages, and it's upheld by the Supreme Court. However, there will probably be some changes in the future as far as our healthcare goes in order to improve our healthcare system even more. Mental illness. So the term mental illness should be reserved for disorder of the brain that disrupts thinking, feeling, and the ability to interact with others. So in the U.S., we sometimes aren't sure if someone has a mental illness or how debilitating that mental illness is. And then we have these shootings that have increased the stigma filled with mental illness. Some people blame the shootings on mental illness. However, I think there should be a separate issue looked at when it comes to these things, like why do certain people participate in these mass shootings? What caused them to get there? What are they dealing with mentally? Also emotionally, and how long did it take for them to get to the point where they actually wanted to take lives of other people? And that is not the same as saying someone else with a mental illness, maybe schizophrenia or depression, since the majority of people with mental illnesses do not commit these acts as far as mass shootings go. And despite there's the stigma that's out there, more people are seeking treatment since the stigmas are decreasing. A lot of people have depression and anxiety, and more people are recognizing these issues and are able to seek help for those issues. The medical model posits that mental illness is rooted in biological factors and can be treated with medicine. There are also social and cultural factors that can contribute to mental illness. Some people might be in an abusive environment growing up, and that can contribute to mental illness. And then there's controversy over the publication and reliance of the American Psychiatric Association's DSM. And that basically has all the mental illnesses that are listed in there. And if something isn't listed in there, then it's not technically considered a mental illness in the U.S., but it could be considered a condition. So the labeling theory says that some behaviors that are viewed as mental illnesses may not really be illnesses. They might be conditions of certain things or of a situation, or it could be something that's temporary that doesn't interrupt how a person is going to progress in life or their daily actions. The government took an early role in mental illness because of the disruptions that it caused. So in 1963, the Community Mental Health Centers Act basically increased government intervention and provision of health care. They wanted to have a place for people to go to receive care for their mental illnesses. So the government became more involved. And then people were also able to be seen on an outpatient basis so they could continue to work and live at home. And we know that when facilities close, people with illnesses usually end up in jails. People might look at them as criminals. Back in the 1600s, European cities confined people with mental illnesses and called them lunatics, and labeled them as criminals and prisoners. And then in 2008, we had the Mental Health Parity and Addiction Equity Act, and that required insurance to basically deal with people that have mental illnesses along with physical health issues. However, we haven't fully reached the equity because certain insurance companies aren't included in this, and that would be like the group health insurance plans. They are exempt, and they might just provide for health services, but they don't provide for mental health services. Sociologists focus on social factors that influence population rates and trends as far as fertility, so reproduction of a society, mortality, the deaths, and migration for people who are moving into a society and people who are moving out. Demography is the study of a population, and we have Malthus' thesis and Marx's response to this. So Malthus argued that the world's population is growing more and more, and we basically don't have enough food for everyone in the world. So we should think of population control and postpone marriage. Karl Marx believed overpopulation is due to unequal distribution of resources. So some people have a lot of resources and some people have no resources or very to little resources. And those that believed in Malthus's theories, they're called neo-Malthusians, and they are influenced by both Malthus and Marx. And they want to stress birth control and the sensible use of resources as far as it being distributed among the population, because the population is continuing to increase, and they're wondering what will be the solutions for dealing with these issues. The population today is counted by using the census, which is going to come out in 2020. And we also supplement that using vital statistics, and vital statistics focuses on births, deaths, marriages, and divorces in a population. And demographers might use questionnaires, interviews, and sampling to get an accurate count of who is in our population and how many people we have. Demography focuses on the birth rate, so the number of live births per 1,000 in a given year. The total fertility rate is the average number of children born alive to any woman. The death rate is the number of deaths per every 1,000 in a given year. We track the infant mortality rate, the life expectancy, and that's the amount of time a person is expected to live, and the growth rate, which is the difference between births and deaths. And we also look at the difference between people moving into the U.S., so immigrating, and then people immigrating with an E, and those are people that leave the U.S. per every 1,000. Considering world population patterns, demographers also study the history of a population to see how many people existed before versus now, and then how many might be projected to exist in the future. So the population of the world has exploded in the past 200 years. And they look at transitions. So the change from high birth rates and death rates to low birth rates and death rates. So a pre-transition is considered high birth rates and death rates with little population growth. Transition is considered declining death rates with high to medium fertility, so that results in a significant population growth. Post-transition is where you have low birth rates and death rates with little population growth. So we had a population explosion, and due to that, China instituted the one-child policy beginning in the 1960s, which no longer exists, but because of that, they have way more men than women living in China right now. And even when fertility rates reduce, developing nations see a continued growth because of a substantial proportion of population approaching childbearing years. And then, as far as the population period goes, is a special type of bar chart that shows a distribution of a population by age and gender. So this is an example of the population pyramid. And so we're looking at Afghanistan, Italy, and the United States. Afghanistan is the top one, and then Italy in the middle, and then the US. And as you see, the population of Afghanistan is increasing. And then in Italy, they had an increase, and now they're decreasing. And we are increasing, but slightly decreasing. Fertility patterns in the US. So we had the baby boom, and that was following World War II. And so people had high fertility, and it was very prosperous as far as the economy. So people were able to have more children. So there's a striking decrease in number of childless and one-child families. People had multiple children. And then there was a strong pressure from society for women to marry and become mothers. So the United States has a fertility rate that has lowered, but we are continuing to grow as a nation. There's a large childbearing population that resulted from the baby boom, and then also immigration has resulted in increase in numbers of children. However, there are other countries that are expected to reach a zero population growth, and that could be because people are leaving or like immigrating to other countries. And there's also older people in those societies, so less people fertility age. And then there are 31 countries projected to decline in population over time. And that would also be another example of an aging population. So a country with stable population growth would have relatively equal numbers of people in each age group and a high median age. Migration. So people move to other countries for various reasons, and a lot of these reasons are due to economic instability. International migration. So people are moving from certain countries of economic instability or violence to other countries with more opportunity and more money. So in the 19th century, the U.S. composition, so basically what the U.S. looked like, was altered through immigrants coming, predominantly from Europe. However, now people are just moving all over the world to the U.S. or to other European countries, from Africa and from Asia. And these people are seeking asylum in a lot of cases. And as of late 2015, there was an estimated 60 million refugees and asylum seekers around the world. So those are 60 million people moving to other places, needing a place to live. However, the host countries that they're moving to have to find a way to balance out the people that are moving in and also the people that currently live there. There's internal migration, and that would be people moving from one state to the other in the U.S. So some people move for climate, for job opportunities, because of the military. So residents are generally free to move from one location to the other. And it talks about an exception, which was a system of apartheid in South Africa, which is no longer exists, but basically that kept things unequal for blacks and whites in South Africa. Any environment will have an effect on the health of a person. Also, the increases in population with economic development can have serious environmental consequences. Human ecology deals with the relationships between people and their environment, and it stresses the trade-offs inherent in every decision that alters environment. So if you think of water pollution, if you think of earthquakes that happen, digging for oil even could have an effect as far as causing earthquakes later. But we dig for oil now because we need it as far as our technology goes, transportation, and human production. The conflict perspective deals with the environment because it shows that countries that have more money and are more industrialized are taking resources and stripping resources from countries with less development. And that happens with a lot of looting in Africa, various countries in Africa. If you think of blood diamonds or people taking minerals. So people from North America, Europe, and China go there in order to strip the resources. Ecological modernization is the alignment of environmentally favorable practices with economic and self-interest through constant adaptation and restructuring. So basically, on a macro level, which is a large level, we can find a way to put our waste and use it back into production. To find a way to basically reuse our trash. So that way we're not harming the environment too much. And on a micro level, that could be people making different decisions as far as using plastic in their own homes, or people that choose to recycle. Environmental justice basically talks about how minorities are disproportionately subjected to environmental hazards as far as where they live, and also poor people are more likely to be victimized by everyday consequences of the built environment. And the example would be Flint, Michigan, and the water pollution that is there. Environmental issues. So among U.S. citizens, so for some people it's not a pressing concern. For others, it is an extremely pressing concern. It just depends on how people feel about climate change and environmental issues. So framing environmental deterioration as problems may prevent seeing it as a byproduct of institutional practices and one's own behavior. So basically it's saying like the way we look at the issue could determine how people react to it. So are we blaming companies, or are we blaming individual people? Are we blaming how we have considered production and using the environment all this time? And then also the effects it's going to have later. So we need to frame it in a way that it can speak to multiple different types of people. And in 2015, there was a global survey, and 45% in the U.S. felt climate change was very serious, compared to 61% in Africa and 74% in Latin America. Air pollution is considered a global serious issue. People are exposed to it worldwide. This is about 1 billion, and there are a range of solutions as far as cleaning up power plants, strengthening air quality standards, and then producing cars that deal with electricity for people to use that people are also able to afford. And people are often willing to change their behavior for short periods, but not long term, as far as sociology says. However, I think if we made lifestyle changes, it would help everyone in the long run. Also, if it was more affordable and people have more access to changing their own behaviors, or if it was mandated by the government, then people would be forced to change their behaviors. But a lot of the behaviors aren't really on an individual level. It's more of on a systematic level. We also have an extreme amount of water pollution. So some people dump lots of trash into bodies of water, and it makes it unsafe as far as drinking, fishing, and swimming goes. So Exxon had their issue with oil spills. Then there was BP's Deepwater Horizon as far as oil spills. And the basic water supply is a problem in many countries. So people don't have access to safe water. Also in the U.S., there are people besides Flint that don't have access to safe water. There will be a lot of people in Appalachia. Their water, they don't have the proper water filtration systems, so their water could come out brown and muddy. And then also people on native reservations, they also don't have access to clean water. And then people that live in poor areas, polluted cities, don't have access to clean water. Climate change. So it's something that is observable, and it's the change of global atmosphere that affects natural weather patterns over several decades or longer. So some places used to be hot are cooling down, and some places that used to be cool are warmer. And then there's also global warming, and that is the rise in the Earth's surface temperatures, and that's due to industrial gases and carbon dioxide. Then we have Kyoto protocols, which is a commitment to lowering the greenhouse gas emissions and having richer nations help the underdeveloped nations reduce their emissions. So in this chart from 1990 to 2015, we see a change in CO2 emissions from various countries. So the US is in the top right, but we have China, India, Russia, Japan, and Germany. So the blue would be the population, the orange would be the CO2 emissions, and then the green is the energy use. So what is causing the climate change? Ilrichs believe that is the pressure of the world population growth and technology boom. And then Commoner believe that it's the use of technology innovations that are destructive to the environment, as far as the chemicals that we use in our food products, detergents, certain fibers, pesticides, herbicides, fertilizers. And conflict theorists see these problems through a lens of a world systems analysis. So how is the world causing these issues? How are we producing these issues? The detriment to our environment that is caused by how we run the world as far as technology goes and production. And the interactionists look at it as individuals and groups can reduce our carbon footprint by thinking about what we consume and how we consume things, and then also how we dispose of things. Environmentalism. So 1970 is when many people came out to celebrate Earth Day. And then we have a lot of citizens that march on behalf of specific environmental causes or speak out about these causes, or participate in their own homes in order to improve our environment. We also have the Environmental Protection Agency, and then we have the Clean Air, Clean Water, and Endangered Species Act that help protect our environment.